I found out I had scoliosis. I was 14. I bent over to pick up my bag and my mom saw my curve and she freaked out. She knew what it was immediately. I was in a lot of pain all the time and it felt like my nerves were being pinched. We went to Children's Hospital and talked to Dr. Sears and he explained exactly what that was and how to move forward with it.
Scoliosis is a condition where the spine, instead of being straight, starts to curve side to side. The treatment for it changes depending on how severe it is. And the earlier you catch it, the more options you have. If you don't catch it early, then sometimes those options are already passed and you can't do anything other than more invasive treatment. Once somebody has entered the need for surgery, that's a discussion that we have based on their x-rays, based on their age.
I remember the first meeting when he told me I had to have surgery. A lot of people, they don't have to have the surgery, but they don't realize at the time that they need to choose to go forward with it. Finding your new normal is better than being in that much pain every single day.
So I was 12 and they found mine right after they officially diagnosed her, and then they were like, hey, we need to check you too.
We started treating Rachel when Ruby was a little prepubescent girl, but told the family that if you have it in one daughter, it can happen in another daughter. And it was within a very short amount of time that we discovered the scoliosis in Ruby.
I was pretty crooked by the time I had surgery. Like beforehand, I had a lot of pain. I decided to have the surgery. I knew what the right choice was because I was 17 and I knew that it would be the right time to go ahead and do it while I was young. So I had a lot of pain anytime I had walked a lot or was standing up on my feet. Just pretty much every day I had a good amount of back pain before surgery, and now I usually don't.
And I still do the exercises that I learned at physical therapy, and strengthening that today still helps a lot. We were pretty lucky that Children's Hospital was local and that they could do our surgery.
They're used to working with children, and you have to be gentle with children. So even though we were not children, they were still very nice and kind.
I think we have the advantage of being a small hospital with big hospital abilities. And the other thing I like to tell the parents is they don't have to feel the need to go to the big city to get that expert care. We have been able to assemble big city doctors and big city care here at East Tennessee Children's Hospital.